Hello, everyone tuning in. Thanks for being here. My name is Ashley Bickle. I work in the recruitment department at Loyalist College, and today's info session is all about our Bachelor of Science in Nursing program, which is going to be a great one. So I have with me here today Suzanne Braithwaite, and she is a professor in nursing, and she's here to give us all that good information. Suzanne, can you tell us a little bit about your professional background and a little bit about yourself?
I'm actually a graduate of the Loyalist Bachelor of Science in Nursing program myself, so homegrown, so to speak. And for the last 8 years, I practiced in primary care at a nurse practitioner-led clinic right here in Belleville. I grew up in Belleville, never really thought I would stay here, but have grown to love it. And in 2017, I started teaching in the Bachelor of Science in Nursing program, the Loyalist collaboration.
That's awesome. So I love that that homegrown kind of thing. That's so amazing. It's such a great area. Can you tell us a little bit about the Bachelor of Science in Nursing program?
Our program is a collaborative program. The curriculum was designed in collaboration between faculty here at Loyalist College and faculty at Brock University. We've been up and running for close to 18 years now. And it's a 4-year bachelor degree. So you are enrolled in the Brock Loyalist program for your entire 4 years. It's a collaboration. Your first 2 years physically, you're here in Belleville with us at Loyalist. And then in year 3, you transition over to St. Catharines, where you finish off with the final 2 years of your program. It's unique in that it's not a transfer program, so to speak. You're actually in the program for the full 4 years. So the faculty and the folks over at Brock and the folks here at Loyalist, we work very closely together. We try and meet every spring. This year might look a little bit different, but we meet every spring, and it really is a joint program. And so when you finish, you have a Bachelor of Science in Nursing degree. It's a science undergrad. We are an accredited program, which means that you can apply to any graduate program at a university if that's what you choose to do after. And you will also finish with what you need to write a registration exam to become a registered nurse.
That's amazing. So can you tell us a little bit about the specifics of how students are learning within this program?
Yeah, sure. So one of the things I love about our program is we have a little bit of a variety. So when you start in the first year of the program, your classes might be a little bit bigger. And when I say a little bit bigger, I mean maybe 50 students at the most. You might have a class of 25 students, and then you'll have even smaller groups in the lab environment and in the clinical environment. So you have an opportunity to work in groups of 8 to 12. You also get a chance to work in those bigger classrooms in your theory classes. And when you get to 3rd and 4th year, your classes get a little bit bigger, but you still have the variety of having your small lab or your small clinical courses. So students learn through a variety of ways. So you'll have a theory course that's usually sitting in the classroom. And you'll have a lab course where you will be working in a simulated clinical environment. It looks very much like a hospital or a clinical setting. And then you get real life experience going into clinical right away in first year. So if you're the type of learner who learns through multiple ways or maybe different ways, you get a chance to learn in all those different settings and leverage your strengths. So if sitting in a classroom isn't your favorite space to be, you get a chance to shine when you're in lab. Versus maybe, practice settings are less comfortable for you, you get your chance to shine in, those bigger theory classrooms. So it's a little bit of everything.
That's awesome. Yes, a nice mix of both for sure. Can you tell us a little bit more about those kind of hands-on, like lab experiences?
Yeah, sure. So we have a renovated wing at the school, and we just had our grand opening a few months ago, but we've been up and running a little bit before then. And it's an interprofessional simulation space. So simulation is where you get a chance to practice caring for real people, but in a setting where no one's going to get hurt. You're not going to, hurt someone's feelings, worry about saying the wrong thing. We have simulated patients, so they look like mannequins, for example. And the entire space is very authentic. Okay, when you walk in, people will say, wow, this really feels like a hospital space. We have an ambulance right in that wing. So, it really feels as though you are transferring a patient from paramedic care into the emergency room. And it gives us a chance to go through and practice some of these more challenging pieces without having the real life component there, without having the real family there or the real patient there. It gives you a chance to really hone in on your skills so that when you get out into the clinical setting, out into the real environment, you have a sense of confidence with you when you do that. We also have a lot of programs at Loyalist in healthcare and even in other programs that we work with in that setting. So in the real world, as a nurse myself, I work with people who aren't nurses. I work with, registered practical nurses. I work with PSWs. As I mentioned, I work with paramedic services. So it's also a space, the interprofessional component of it, where we can connect with those other groups. We've had a simulation that involved our border control program, one that involves our policing program. So it's a chance for us to start to have that interprofessional experience and start to, learn what it's like to work with those other roles, to have that communication, and just to get a sense of what their role is and what our role is and how we can work together. So it's really, we call it campus clinical very much. When students walk in, you're in your full uniform, top to toe, I say. You'll have your stethoscope, you'll have your shoes, you'll have your name badge, you'll have everything on. And it just really helps with that feeling of, getting into character almost and feeling as though this is real, so that when you do it in a real setting, you've already done it before.
That's amazing. Yes, so very cool. I've definitely seen those nursing uniforms firsthand, and it looks very real deal for sure. So can you tell us a little bit more about what makes this program so unique?
A few things. So, and I'd like to start actually by saying, I mentioned that I graduated from this program, and I've come back to teach here for a reason, and it's because I truly think that this program is unique. Maybe I'm biased, but what we have here is we have a smaller setting, okay, with all of the bells or whistles, so to speak, that you need to really do well in nursing. We also have close contact with your faculty in those smaller groups. So one of my favorite things about teaching at Loyalist is also one of my favorite things that I recall when I was a student. And that's that close relationship I had with my faculty, with student success services, really truly with everyone who touched that program in any way. And it's still what I enjoy the most. So the students who have had a chance to connect with, I get to know them, they get to know us. Gives us the chance to see them as, as real people, because we know them not just for their number, we know their name, and we actually get to learn a little bit about them. And so, nursing is a relational profession. That's a lot of what we do. And so for me, as a registered nurse myself, that piece is really important. So it gives me that opportunity to connect with the students. The other piece I would say that's unique is the opportunity to dabble in multiple settings. And you will actually start your clinical placement in first year, which is not standard across all programs in Ontario. Some programs have it, but not all do. So here in the Loyalist Bachelor of Science in Nursing program, we believe that nursing is a practice profession. And in that, what we do is we connect you with either real cases in the lab or with real people in clinical. And if you're a student here, your clinical starts in second semester, and that means in second semester, you're out there. You're getting to know people, you're getting to know what that experience is for them through health, illness, and hospitalization. And then you carry that through every semester. After second semester, we'll have a clinical component. So every semester is an opportunity for you to really touch into that practice, which we, really value in this program, and sort of keep your hand in it. The other piece that I really like, Ashley, is that it gives you a chance to see multiple sites. You get a chance to see what we can offer here at Loyalist and all the wonderful things we can do here. And then you still get the chance to go to Brock University, totally different city, totally different building, and you get to see both sides of it. So it gives you a little bit of sense of flexibility in that adjustment as you move from second year to third year, and to really see the whole program come together, which I think is really nice.
Let's talk about some of the places that some of our students have gone on these clinicals.
On the clinicals, yeah, so they get a chance to touch really, a wide variety of aspects of our health system. So starting out in hospital, caring for people with episodic experiences with illness or hospitalization. So maybe post-surgery, for example, would be something you might see in second semester. Once you move into second year, you move into two streams, and every student will have a chance to do both. So one is care of the acutely ill client, where you will have a full 14-week semester on a medical surgical unit in the hospital. So that, we have lots of great hospitals that are local to us, and they're wonderful partners. We're always quite grateful that they accept our students so with such welcoming open arms, because that is a very, very busy placement, and students always enjoy it because they learn so much. And then in second year, we also have care of the young family, which gives you an opportunity to work on a maternal child unit and to have some placements in a pediatric unit, as well as in a special care nursery. So in that placement, you will do half of your placement there, and then half of your placement in the community, caring for all aspects of the young family, maybe in a clinic, working with public health, and so on. And again, that's a unique part about our program. Not every program has that opportunity, but we're quite grateful to our partners at our hospital here that our students do get a chance to work with families on a maternal child unit, as well as in the communities. And then in third year, you will have a full course dedicated toward mental health, and again, another full semester placement in a mental health setting. So sometimes part of that might be in a long-term care facility, and others may be in community organizations that are supporting individuals who are experiencing variations in mental health, mental illness. And then again, in third year, you'll have chronicity, so caring for people who are experiencing chronic conditions in a variety of settings, depending on sort of how our health system's evolving. It can change. And then in your fourth year, you do a community placement, and those placements vary. Again, you may be in public health, you may be working in group homes. And then your very final semester, so semester 8 in fourth year, is an entire clinical rotation, the whole semester. We usually split it in half, so you can get a chance to try 2 different settings. But that's your final, we call it consolidation, where you're consolidating all of your knowledge, and you get a full semester working one-on-one with the preceptor to hone in on those skills or on any learning that you need to really solidify before you walk across that stage and then apply for your registration.
Absolutely. And Suzanne, I want to thank you so much for your time and for your amazing insight into the Bachelor of Science in Nursing program. And to all of you out there listening, I hope you got some great information. I know I did. So I hope you enjoyed this info session. And again, Suzanne, thank you. And I hope you keep well. See you guys later.
Thank you. You too. Bye.